Well, thank you for having me. I'm very honored to be here this evening. I'm grateful to share my perspective on how COVID-19 has impacted our high quality early childhood program. On Thursday, March 12th, we had about 175 children gleefully playing around our center. By the following week, once schools were closed, we had about 8 to 12 children in daily attendance. Those days were rough. We were determined to keep our doors open and provide services to the essential service sector of our community. We were also determined not to furlough any team member who wanted to work. They say that small businesses run America. Well, COVID-19 is impacting providers everywhere, and some are struggling to stay afloat. Some have even closed. Others were ready to open, but were unable to secure proper PPE to secure and run their business. We are a critical support for working parents. There's no question that we are all, as much as we can, must get back to work. The only question is how. We are grateful that our Governor Kemp, saw that the need for frontline workers and other essential personnel needed safe places for their children to attend while they were saving lives. He did not force us to close and indicated our work was essential. However, as thermometers became scarce, the price of a 4-ounce bottle of hand sanitizer skyrocketed and wipes were nowhere in sight. I feared for what was in store the weeks ahead. Even though we had reduced our operational hours, it became more costly just to keep our doors open for the few precious children we had. We were using hospital grade and commercial solutions to sanitize our outdoor play equipment throughout the day. Those supplies began to run low. I would send out emails to other owners looking for leads on supplies, leads on a spare thermometer, or more parents, as more parents began to enroll their child. There was no centralized way for providers to obtain supplies. I actually sent an email to a large healthcare insurance provider to express my frustration. Even though the costs were enormous for the few children we had, my mother, who's the owner of the establishment, always has impressed upon us, we will do for one what we do for many. We did not sacrifice the standards of our care, but we saw the effects on our bottom line. My peers and I would post messages on various platforms looking for thermometers, gloves, sanitizers, lab coats, anything and everything that was in line with CDC recommendations. This was a strange system, to say the least, as if it were a black market waiting on someone to say they had a connection. We were worried friends would be sending me links to best homemade sanitizers. Quality matters. We cannot be content with that, and we cannot be content with making high quality care, especially in the age of COVID, cheap or cost effective. Ultimately, the COVID-19 health crisis has merely exposed how unsustainable the financing of our early childhood system actually is, with the burden of providing high quality care placed on the shoulders of providers. Right now, we need PPE, but ultimately for things to change, we need policymakers to recognize the importance of investing in early care and education with a focus on the critical comprehensive services, education, nutrition, and social emotional development that young children need and receive when attending a high quality program.
Thank you. And Congresswoman Lee has a question.
Thank you very much. Thank you. Wande Meadows, right?
Yes, Congresswoman.
Really, thank you so much for your testimony. And listening to you, I'm thinking, gosh, these young people are so fortunate and blessed to have you. And here you are struggling just to make things right and safe for them. You shouldn't have to do that. And we should be providing all of the PPE that you need. And so I'd like for you to just lay out the type of PPE supplies that you would need in order to safely reopen. And also, we know that so many minority families are essential workers, and so they're more likely to depend on child care services. And so how do you see this inequity?